Have you ever had a headache, heartburn, nausea, or a cold during pregnancy and wondered, can I safely take this medicine for this? Many women assume that if a medicine is available at pharmacy, it means that it's safe during pregnancy, but that's not always true. Some medications are recommended during pregnancy, while some are not suitable depending on your age, stage of pregnancy, your health, and medical history. In today's video, I'll be discussing 10 medicines and supplements that every pregnant woman should discuss with a doctor. Make sure you stay to the end because medicine number 10 is what many women forget about, yet it plays a vital role. Let's get started. Number 1, folic acid. Folic acid is a B vitamin that helps support the healthy development of your baby's brain and spinal cord during early pregnancy. That's why women who are trying to conceive are often encouraged to discuss folic acid supplementation before pregnancy. If you are planning a pregnancy or you're currently pregnant, you need to discuss this folic acid supplementation with your healthcare provider. Number 2, prenatal vitamins. During pregnancy, your body requires additional nutrients to support you and your baby. Prenatal vitamins may contain nutrients like iron, vitamin D, and other nutrients and minerals that can help support you and your growing baby. Many women wonder if they can just take a regular multivitamin, and that depends on you and your health, which must be discussed with your healthcare provider. A healthcare professional can help determine which kind of supplements that you need for your pregnancy care. Number 3, iron supplements. Have you been feeling unusually tired, weak, or exhausted during your pregnancy? Iron levels can sometimes be low during pregnancy because your body is working harder to support both you and your growing baby. Iron supplementation is mostly required during pregnancy. However, iron supplements can sometimes cause constipation, nausea, stomach discomfort. If you've been prescribed iron supplement, ask your healthcare provider the best way to take it to prevent the side effects. Number 4, vitamin D. Vitamin D is another supplement that a lot of pregnant women do discuss during pregnancy. Vitamin D do play a role in bone health and overall well-being. And a lot of women do have low vitamin D levels without realizing it. And your healthcare provider may suggest using vitamin D supplementation depending on your health history. Always follow professional advice regarding the prescription that you need to use during pregnancy. Do not use less than the prescription and do not use more than the prescription. Number 5, medicine for nausea and morning sickness. Morning sickness can be one of the most challenging parts of pregnancy. Some women experience mild nausea, some women experience extreme nausea, and some women don't experience nausea at all. If nausea is affecting your ability to eat, drink, work, or function normally, you need to speak to your healthcare provider. There are different ways in managing nausea, including your nutrition strategy and medical treatments. Severe vomiting, dehydration, dizziness, or inability to keep fluids down should never be ignored because a lot of women do feel these symptoms and they always feel like it's part of pregnancy. But when it's become severe, you need to speak to your healthcare provider. Number 6, antacids for heartburn. Let's talk about heartburn. Many pregnant women experience a burning sensation in the chest, in the throat, especially later in pregnancy. This often happens because the pregnancy hormones can affect the digestive system. Some women find relief through lifestyle changes, while some might need additional help. Not all products are appropriate for every person, so discussing your heartburn treatment with your healthcare provider is very important. Number 7, pain relief medicines. Pregnancy can bring headaches, back pains, muscle aches, and one of the most common questions that pregnant women always ask is, what can they use for their pain? It's very important to never self-medicate during pregnancy. Different medications have different considerations during pregnancy, especially on your health history. If you are experiencing frequent pain, you should discuss it with your healthcare provider so they can provide appropriate management or medication for you. Number 8, allergy medication. Seasonal allergies can still affect you during pregnancy. Symptoms such as sneezing, itchy nose, nasal congestion, and runny nose can be frustrating. The best approach is to discuss your specific medications to your healthcare provider so they can provide you with a new medication that can help you while still being pregnant. Number 9, medications for chronic health conditions. If you have asthma, diabetes, thyroid disease, epilepsy, high blood pressure, or another ongoing condition, never stop prescribed medication without medical advice. You need to discuss it with your healthcare provider. Some women become very concerned after learning they are pregnant and stop their medications. However, uncontrolled health condition can also put risk on your pregnancy. Always seek professional advice before making medication changes. Number 10, vaccination during pregnancy. Many women don't discuss about vaccinations during pregnancy. However, certain vaccination may be recommended during pregnancy, depending on your circumstances. Vaccinations discussions are very important during pregnancy because protecting the mother may help protect the baby. Your healthcare provider can explain what vaccinations are important for you and how they can help protect your baby. Important reminder: before we finish, I want to share something very important. Never take any medication simply because it worked for someone else. Everybody's body reacts to medication differently. Your friend, your sister, your neighbor, your mom, or someone on social media may have a completely different pregnancy, and you shouldn't compare yourself with them or the medications that they use. Factors such as your age, medical history, trimester, allergies, existing conditions, and current medications matter. What's appropriate for one person may not be appropriate for another. That's why conversations with qualified healthcare professionals are very important. Do not be afraid to ask a question, even if it sounds stupid. If you're new here, my name is Esther. I'm a maternal health educator, passionate about helping women understand pregnancy, newborn care, postpartum recovery, and early motherhood. Please remember that this content is educational and should never replace personalized medical advice. These resources are designed to help parents feel prepared, informed, and confident every stage of pregnancy and newborn. If you found this video helpful, make sure you like, share, and subscribe, and share it to anyone who is pregnant or any mom who you know. Thank you for watching, and I'll see you in the next video.